Money and resources and keeping it at a good standard because of probably the lack of money that they may have.
The biggest challenge for the NHS is for the NHS to be funded according to the wishes of people, not according to the policies of government.
You see that there are far more elderly people. You know that people who had life-threatening or limiting conditions are living much longer. In fact, I'm one myself.
We are living longer, so there are going to be more elderly people and less people working. But I do think we should make people work till they're a lot older. You know, the pension age should be later, because it also has been proven to show that less people will get dementia if their mind is still active. But that depends on the workplace that they need to then encourage to employ more older people so that we've got more people working, and basically keeping people healthier.
Someone brought up that type 2 diabetes is based on lifestyle as opposed to something that you're born with. And the idea was that basically if we could get people to start paying for that service themselves, it would kind of give them an incentive to fix their lifestyle. However, I think what the opposing side was saying was that people aren't educated enough due to the lifestyle they've lived, where they've been, to actually know that I shouldn't be doing this or I shouldn't be doing that. So it was kind of, I think at that point with the educational topic, I kind of joined them both. And I was like, what we're saying is that we need education, but we need it quickly.
I think the biggest challenge is funding, and I think really it's down to what kind of government we have and what they prioritise. I think there's always going to be big public opinion about things, but really when it comes into implementing those changes to the NHS, it's going to come down to the government and how they prioritise and what they decide to spend things on.
The biggest challenge is not to become a dinosaur. It has to change. It doesn't need to disappear, but it does need to change. It's always changed since the beginning. But my grandfather was instrumental in helping set it up, and when the free prescriptions came in, people used to queue up and ask for a free prescription for a large amount of cotton wool. So that was changed. No, you couldn't come in for cotton wool. So, changes happen all the time. It needs to be refined and made better.